So it's estimated that more than 5.8 million people in the UK are living with diabetes, which is at an all-time high. 8% of these people with diabetes have what we call type 1, 90% of people with diabetes have type 2, and 2% of people have a rarer type of diabetes, which can be something like gestational diabetes, which is something you get during pregnancy. So people with all types of diabetes can be at risk of developing serious complications, and every week diabetes leads to around about 184 amputations, more than 930 strokes, 660 heart attacks, and over 2,990 cases of heart failure. This is why early treatment can help prevent or lower your risk of serious health problems from high blood sugar levels. So things that can include that are sight loss, amputations, kidney disease, heart attacks, and strokes. So it's important to get all of these health checks that we're going to talk about today. Some of the diabetes health checks that people are more likely to miss out on are things such as urine checks for kidney disease, eye checks, foot checks. It can be difficult to access the annual review or diabetes health checks appointments, but as routine NHS care, it's something that GPs and hospital teams should have set aside time for. So don't feel guilty if you're looking after somebody or you have diabetes yourself about chasing them up for their appointments. They are there to help you and your team to monitor how diabetes is affecting other parts of your body, and to help you help to keep you or the person you're supporting healthy. So the NHS spends around about £10 billion a year on diabetes, which is around about 10% of its actual entire budget. And almost 80% of the money the NHS spends on diabetes is on treating the complications. In some hospitals, over a quarter of the beds are actually used by people with diabetes or a complication with their diabetes. And in 2022-2023, there was 66 million items prescribed for people with diabetes in England, which is an increase from 42 million 10 years earlier. So you can see it is a massive increase. So diabetes is a debilitating disease that can affect people on a daily basis on many different levels, and it remains considerable cost burden to the NHS, and the majority of those costs are still spent on potentially preventable complications, which is why we're Diabetes Week this week is doing a big push on these health checks. So what are the health checks? The NHS recommends 8 annual care processes for every diabetes patient. Diabetes health checks, or the annual care processes, something they look at is the blood glucose, which is what we call the HbA1cs. We look at blood pressure, they will look at cholesterol, they look at cholesterol at retinal screening, they then look at kidney function, they'll look at the BMI, then they do foot examination, and then a smoking status. And we'll look at these individually throughout the webinar. So HbA1c is the core blood test, and the purpose shows an average blood glucose level over 8 to 12 weeks. And it matters because it detects any poor control. So you can start putting things in place to help get a better control of blood sugars. So if you have an elevated HbA1c, it can mean poorly controlled diabetes, and some pregnant women might experience what we call gestational diabetes or pre-diabetes. If you have a decreased level, it can mean what we call hemolytic anemia or chronic renal failure. So treatment for diabetes may involve lifestyle changes such as diet, medications, insulin therapies, and regular monitoring blood sugar levels and your HbA1cs levels, as it is an important part of managing diabetes and preventing any complications. So if you're looking after somebody with diabetes or you have diabetes, something like what we call a diabetes diary is really important, so we can see what foods you eat and what times, so we can start to pick out what will increase it and what decrease it, or what doesn't do enough for you. So a diabetes diary is really important, and what time you've done your blood sugar checks, what time you did them, what you ate prior to doing them, how long did you do the check after eating or before eating. So diabetes diary is really helpful for your diabetes nurses. So blood pressure, a heart risk, why it's checked. Diabetes raises heart attack and stroke risk quite high. So we have a nice guidelines, and the target for a normal blood pressure is anywhere between 140/80. So early control prevents heart disease and kidney failure. So people with diabetes and high blood pressure are more at risk of having a heart attack or stroke. So it's important to know how to look after the blood pressure. If you've got diabetes, you need your blood pressure checked by a healthcare professional at least once a year. This check is part of what we call the annual review. And if your blood pressure is high, which we call hypertension, you'll need treatment to bring it down. It's because it puts a strain on the blood vessels and can damage them. This can make it harder for blood to flow around your body and reach all the vital areas it needs to, like your heart, and you're more at risk of having a heart attack or stroke. So it also puts you more at risk of developing all types of diabetes complications, like serious problems with your feet, your eyes, your kidneys. And there's lots you can do yourself to help manage your blood pressure, because your lifestyle does have a direct impact. But lots of people also need to take medication to treat high blood pressure and reduce the risk of complications. And it's really important to know that you might have high blood pressure and feel fine, because there aren't usually any symptoms. But if you feel healthy, high blood pressure is damaging the blood vessels, and you do need to get treatment. That's why you should never miss a blood pressure check. It's a free test, and it only takes a couple of minutes. So high blood pressure is sometimes called what we call a silent problem, or the silent killer, as it usually has no symptoms. And some people with very high blood pressure say they have headaches, but that is rare. The best way to know if you have a high blood pressure is to get it checked by a healthcare professional. And the causes and the risk factors of high blood pressure, for most people, there's no single cause, but we know that some things can make you more at risk, and these are what we call the risk factors. One of these is having diabetes. So high levels of sugar in the blood can lead to something called atherosclerosis. This is basically when there's a buildup of a fatty material inside your blood vessels, and this narrows them. And the narrower the blood vessels get, the more the pressure will build up. So the more stress your blood vessels are under, the harder it is to push blood around important areas of the body, which means that your feet and your eyes and your heart are then seriously at risk. There are other risk factors you can't do much about. So obviously age, family history, high blood pressures, sometimes the ethnic background is African, Caribbean or Black African, and there are risk factors you do have control over. So looking at how much salt you have in your diet, if being overweight, not being active, smoking, drinking too much alcohol, stress, drinking too much caffeine, such as coffee. And if you make changes to the diet and lifestyle, it does reduce the risk of developing high blood pressure. Another test that you would have is what we call a cholesterol and lipid profile. The focus is looking at total cholesterol and what we call the low density lipoproteins and the high density lipoproteins, or the triglycerides. So we often look at a target around about below 4 millimoles for total cholesterol. And it's for the cardiovascular protection in diabetes. So we're going to we'll talk a little bit about these and what they are. So a lipid panel or a lipid profile is usually performed to check the lipid levels in the blood. And lipids basically are nothing but fats that can be dissolved in the blood. And if these lipid levels are found to be high in your blood, then the risk of getting heart disease and strokes will increase. So the lipid profile test measures the total cholesterol level you have in your blood. It means that both the harmful, which is the low density lipoproteins, which are harmful cholesterol, and the good high density lipoproteins, cholesterol, also what called a triglycerides, a special kind of fat that is found in the blood, can be measured with this test. And it's important to have cholesterol in your body because cholesterol is a smooth matter, and at regular intervals it's very much vital for biological functions, like playing a major part in the formation of cell walls, which enables a body to generate vitamin D, which produces it also produces digestive bile juice in the small intestine, and that allows the body to generate particular hormones. And if the levels of cholesterol will increase rapidly, then there's a chance of it becoming a quiet threat. That places you at a risk of several critical complications, such as peripheral artery disease, heart attacks. So cholesterol is transported in the blood and it's connected to protein molecules called lipoproteins. And the two main forms, sorry, the two main forms of cholesterol are what we call low density lipoprotein. It's usually known as a bad or harmful cholesterol, as too much of this type of cholesterol can intensify the threat of many deadly diseases like blocking of the arteries, which are also called arteriosclerosis. This will become the major cause of cardiovascular ailments. And the high density cholesterol, it's called good cholesterol as it serves as a guard, and it actually eliminates all fatal or bad cholesterol. And HDL has three main effects. It removes excess cholesterol or excess fat from your blood vessels and other tissues, and it returns it to the liver to be recycled or removed from the body. It also has an anti-inflammatory effect where it helps protect the artery walls against LDL, which is the bad cholesterol. It also has an antioxidant effect, which helps protect cells and important chemicals in the blood and tissues from being broken down. So that's why, if you understand a little bit about that, that's why it's really important that we do have this cholesterol and lipid profile test, which is another really important test that we need to be taking. Diabetic eye screening is another test that we will have. Diabetic retinopathy is basically it's a leading cause of blindness in the under 65s. It is free and annual screening from age 12 via the NHS Diabetic Eye Screening Programme, and that's where they take photos and detect changes before you can get vision loss. If this is picked up before, then sight loss can be stopped. So diabetic eye screening is an important part of diabetes care. Screening is the best way to find diabetic retinopathy early, which can prevent and even reduce damage to your eyes and sight loss. It is your choice if you want to have diabetic eye screening, and if you don't want it, you can be asked to be invited up to 3 years, but you have to write to them and tell them your local diabetic screening program. Then 3 years later, they will contact you to see if your circumstances have changed and if you want to come back and attend screening again. But because it's free, it doesn't take long. It is worth having it done because it does pick it up much earlier. So preparing for the diabetic eye screening, once you've had the process done, your eyes may be a bit blurry for a few hours after the eye screening. That's because the drops they will put into the eyes, it means you're not able to drive after the test. So it's really important, if you look after or care for somebody with diabetes or you have diabetes, it's important that somebody takes you and brings you back, because he won't be able to drive and he might find it difficult getting on buses and things like that. So have somebody with you. And plan how you get to and from the test. So get someone to come with you to your appointment. If you wear glasses or contact lenses, obviously take them with you with any lens solutions if you need it. You may also take sunglasses, because if you come out and it is bright, it can make it quite sore. So wearing sunglasses after the test is quite important. So during the test, basically what they'll do, it lasts around about 30 minutes. You'll be asked to read normal stuff that you do for a normal eye test, like reading letters on a chart. They then put these eye drops into your eyes and make your pupils much larger. It can sting a little bit sometimes, and it will make the eyesight a little bit blurry. Once they start working, you'll look into a camera, and then take photographs of the back of your eyes. So they can, obviously, with the photographs, there will be a little flash, so which you need to be aware of. And once that's all done, after 30 minutes, you go home, and then within, I think it's about 3 weeks, you'll then get the results of the test. Once they've been looked at by an expert, and they will tell you what's occurred during the test and what they've seen. Sometimes you may be asked to do a test again if the images aren't clear enough to get a result. But talk to your diabetic nurse or your GP surgery, the eye screening service. If you don't get your result letter within 3 weeks, ring them up and give them a kick. There are 3 possible results. So diabetic eye screening results, and what they mean, basically, you'll get a letter saying that there's no changes, no retinopathy. So no changes are found in your eyes, which is great. It's what you want. You maybe have asked them to come back and do a test in around 1 to 2 years. Another test may be some changes to one or both eyes, so background retinopathy, and it's basically where the diabetes has caused a small change to your eye, but your sight may not be affected currently. So you'll be invited to go back for a screening again in about a year, or sometimes a little bit earlier. And it's basically what they call referable retinopathy. So it's where the diabetes has damaged your eyes and your sight, and it could be slightly affected. The letter will explain in detail what your next process is and what treatments they can do. And then you'll be referred to a specialist to talk about what happens next. So you may need some more tests. So you can reduce your risk of developing diabetic retinopathy, or help stop it getting worse, by keeping blood sugar levels and blood pressure and cholesterol a nice level. That's why it's really important for these tests. So kidney and health monitoring tests. Why are these important? So the urinary albumin to creatine ratio is basically what we call the estimated glomerular filtration rate. And it's basically diabetes' #1 cause of kidney failure in the UK. So we need to have your kidney checks at least annually. And you can see from the image there, what we have is a healthy versus diseased kidney. So diabetes nephropathy is basically a condition that affects the kidneys. It's called diabetes-related kidney disease. The kidneys act as a filtration system to flush waste from your body. So moreover, kidneys also help balance the body's fluids and electrolytes. And 1 million nephrons in the kidneys filter our blood, which maintains a good balance. However, diabetes causes diabetes-related nephropathy. Therefore, the body can't process the blood sugar or the glucose from the foods and the drinks that you consume. So the unprocessed glucose then damages the kidney membranes and other parts of the nephron. And it's also the unfiltered fluids and toxins that should exit with your urine accumulate in your body, and is basically why we have a big link between diabetes and the kidneys. Diabetes kidney disease is diabetes effect on the kidneys. It takes years to develop, and sometimes you'll have no symptoms at first, as it's damaging the kidneys over a period of time. So consequently, the kidneys start to lose their ability to filter out waste, leading to a toxic buildup in the body. So the damage progresses, and you may lose appetite. There may be fluid retention, so you start becoming edematous, where you get the swelling of the fingers, feet, and other parts of the body. So the condition can lead to abnormal amounts of protein in the urine also. And untreated diabetic nephropathy can lead to kidney failure, high blood pressure, and also aggravate kidney damage. So early diabetic nephropathy does not show any symptoms. So it's basically diabetes-related nephropathy symptoms appear when it's affected at least 80 to 90% of the kidney. which is why if we have these urine tests done annually, we can start to see and pick up that there's something going on, and then we get some treatment. But by the time we get to 80 to 90% damage, it's irreversible. So symptoms can include swelling in the face, hands, feet, what we call edema. You can have vomiting, can have fatigue, shortness of breath, start to lose appetite or have no appetite. You can have what we call bubbly urine. They can become confused. They can have itchy and dry skin, muscle cramps, and have less need for the insulin. Also, protein in the pee cannot be detected unless your healthcare provider conducts a urinalysis. As the disease advances, the kidneys cannot filter the waste from the blood, so consequently the waste will build up in the body, reaching toxic levels, and it's basically called what it's known as uremia. And moreover, uremia often leads to confused state, and the affected person can eventually go into a coma. So yearly having the urine test done, having the dipstick done, again, as you can see, why it is so important that we do go and have this test. Foot checks and nerve testing. You can see it's something called ACT now. This has been endorsed by the Diabetes UK Juvenile Diabetes Research Foundation. It's also been endorsed by International Diabetes Federation, Diabetes Foot Care Network, Diabetes Foot International, the Royal College of Podiatry, and obviously from Diabetes UK. It's really important that we use this. So the ACT now stands for accident. So if you've had an accident and damaged the foot in any way, stood on a nail or cut it, let's get it checked. Any changes in the coloration of the foot. So is it looking red and puffy on one foot, or just one toe? Can we notice there's an increase in temperature on one of the feet or both feet? Is there new pain in the feet when they're walking or sitting or standing? Have you noticed any pus? Is there any oozing from any wounds on the foot? And is there a wound? We need to get this treated, because if it's not, they can end up with amputation. So basically they believe if you follow the ACT now, it can actually, if it's adopted into what we call clinical practice, it can do a 50% reduction in major amputations among people with diabetes. And if we do this, it can actually, 50% reduction can be achieved within 5 years. So follow the ACT now, and you can get all that sort of information of ACT now online, and you can get the posters to put up around your services or on your phones, so that you can actually have a prompt for you and other staff. Smoking status. So why is it up? Why do we need to worry about smoking if we have diabetes? And that's because smoking and diabetes actually will double your cardiovascular risk. So there's lots of stuff online. If you have a smoker, get some referrals to stop smoking services. There's free tools like the NHS Quick Smoking app. Try and get as much as you can. Give them as much help as you can to try and encourage them to stop smoking, because it will affect the cardiovascular risk of developing serious complications with the diabetes. Weight and BMI monitoring. Basically, the reason why we have the weight and BMI monitoring, as you can see from the graph, if you are from a Black or a South Asian, Chinese or Arab ethnic group, you may need to ask your GP about diabetes prevention, a lower BMI than is currently recommended for people of white population. And we're going to look a little bit of why that is. So obesity is a major risk factor for type 2 diabetes progression. The target for a normal BMI is 18.5, 24.9, depending on your ethnic background. So you can get support from the NHS Diabetes Prevention Programme and local weight services. Interventions to prevent diabetes should be triggered at a different body BMI for each ethnic group. So research has found that some ethnic groups will benefit from prevention at a much lower BMI than is currently used. Type 2 diabetes is related to body weight and is much more common in people with obesity. In white populations, BMI of 30, but this figure is not appropriate guide to other ethnic groups. So with research since 2004, the NHS has recommended diabetes prevention for people in some ethnic groups with BMIs of 27.5. However, this was based on limited evidence, and they've now done more research and they have a better detailed BMI value, which can increase the risk of diabetes in different ethnic groups. So, for example, South Asian people with BMI of 24 were found to be at risk of diabetes. The study do this data over 1 million people, and it found that people of all ethnicities other than white were at risk of diabetes with a BMI lower than 30. And in some groups, this was actually much lower. For example, some of the research suggests that people of Bangladeshi heritage could benefit from diabetes prevention if with a BMI of 21, which is really low. So BMI is basically calculated by dividing someone's height in meters by their weight in kilograms. And obesity is typically defined as a BMI of 30 or more. And doctors tend to trigger actions to prevent type 2 diabetes at that BMI. Some things could be giving advice on diet and physical activity, plus the use of a drug called metformin, and that can improve the control of your blood sugars. So definition of obesity is plus 30. It was developed using data mostly from white populations in 2004, and in the end the World Health Organization recommended lowering the BMI cutoff for Chinese and South Asian populations to 27.5, and it's because these ethnic groups were developing type 2 diabetes at much lower BMIs. The NHS basically said we're going to trigger diabetes prevention in Black, South Asian and Chinese people, and a team of researchers explored whether this prevention should be started at still lower BMIs for some ethnic groups, and they looked at a wide range of ethnicities than they did in previous studies. So basically, people of colour are more likely to store fat around the middle, which is what we call visceral fat, and it can build up around important organs like the liver and the pancreas. And having too much of this fat is just one of the factors that can affect your health and increase the risk of type 2 diabetes. And it's called it creates something called insulin resistance, which is when your insulin can't work properly, which is the increased chance of having high blood sugar levels. So having your weight checked and having your BMI done again, as you can see, is really important, and it really does depend on your ethnicity, on how likely you are to become diabetic. So how often do we have these checks? We have the blood check should be done every 3 to 6 months. And you can have the blood test and also giving information with your diary. It's really, really good information. The eye screening can be yearly, 2 yearly or 3 yearly. They will do the first time when you're first diagnosed with diabetes. It will be done annually, and then see on what the results are will depend on whether you then go for 2 years or 3 years later. Having your foot check annually is really important. Having your BP and your cholesterol and the BMI and the smoking status, all that information should be done annually. And then your kidney function and blood and urine tests, again, should also be done yearly. Obviously, it takes a team to do this, and basically who will provide you your diabetes care will be your GPs, the practice nurses. You can have a diabetic nurse specialist, you can have a podiatrist, dietitians, optometrist, and where GP surgeries, community clinics and hospitals is where you can go. Diabetes can cause obviously other health problems that become serious if it's not picked up and monitored or treated in the early stages. So diabetes health checks regular are basically really important that we get it done. Diabetes management, obviously, it takes a team. You, the person you support, the doctors, the nurses, dietitians, all need to work together to get the right outcomes for a person suffering with diabetes. What happens if you don't have the checks? Obviously, the risks are undetected complications such as eye, kidney, heart. And as we look to the kidney, until 80 or 90% of it is damaged, is before you're really going to start to see a change. So that's why it's really important that we get the checks done. Emergency hospital admissions will be more of a risk. So start if we don't have the foot checks, getting infections in the feet and getting infections in the blood, ended up having amputations. So as we looked earlier, there's 184 amputations a week due to diabetes, and that's from Diabetes UK. So simply go get apps that can help you. There are things to stay on track. I don't know if any of you have ever seen this. It's called My Way. Diabetes. You can get reminders. You can speak to your GP. They can send you text reminders. You can even, if you don't want to go, you can have digital consultations, and you can send you home test kits so you can do the checks and send it in yourself. So ask your GP about digital health support, because some people, you can't get them to their doctors, don't like it because of the environment, things like that. So speak to them about digital health support. What can they do? The app is really, really easy to do. You can download the app onto your phone, My Ways Diabetes, open up the account and get started. It's great news. It means you can now get quicker access to information platform, any diabetes related medical data. You can also get e-learning courses, and it can all be done at a tap of the app. So if you haven't got it, have a look. My Way Diabetes, look it up. There are other apps available. That one is recommended. So common barriers in the UK to why people don't get these checks done: time off of work, cost of transport, how are you going to look after the kids, think about language or even cultural barriers, and they don't have a good health literacy. So it's really important that GPs, dietitians, nurses, that they have flexible appointments and even translation services. Sometimes it can be frustrating if you're asked to have the same checks at a hospital. So maybe you have going to your GP and having a test, and then you actually go to the hospital to have well, I've just had that one done. So it can get a bit frustrating for people. Well, I've had it done, so I'm not going again. Stop it happening. If you have your checkups done by a local hospital team, ask your hospital team to send the information to the GP, and ask your GP to add any test results from the hospital to your records. It stops the chance of you having to have doubled up procedures when you don't really need it. Some people don't go to the appointments because they have a fear of being judged. They might not get on with their healthcare professional, may think they're quite brash, or they feel they're being judged, especially if they're overweight. It can be difficult to attend appointments with these. So ask if it's possible, see a different healthcare professional. You shouldn't not go because you don't like who you're seeing. Change who you're seeing. If you think it'll be better for you and you're more likely to go, change your GP, whatever is better, so that these tests are actually done. So ask to see if it's possible to see a different healthcare professional for the diabetes health checks. If it's not possible because the relationship with the person doing the checks is preventing you from going, think about whether you want to change the practice. Some people worry about starting a medication. So the thought of having to start medication for diabetes for some people can be worrying. About giving themselves injections or taking tablets, about remembering to taking tablets. Some people may think they've read about certain side effects, but there's several different types of medications now, especially for type 2 diabetes. So if you are having side effects and you don't like taking it, don't worry, there is other stuff available. If you don't like how it's making you feel, ask or talk to your diabetes team about what medications may be best. Some people prioritize other things above health. It can be hard to make time for health checks, especially if you're not sure why are they important. As we can see from what we talked about earlier, they are important. Some people have very busy lives, which means that they can't mean prioritizing work or family over other life pressures. It's really important that we know that diabetes-related health problems can come on quicker especially in younger people. So it's really important to take time out to make sure your health is being looked after. Get this stuff done. Encourage people to go and get the health checks done. Once they go and they've had it done once, you can see actually it's not that bad. So start to get them used to this process. We need to also look at addressing inequalities in diabetes care. Health inequalities says higher prevalence in South Asian, Black African, Caribbean communities in the UK. So you need to have a targeted outreach, especially culturally appropriate education and diet advice. Health inequalities are unfair, and they are avoidable differences. So diabetes can affect millions of people worldwide, but not everyone experiences it in the same way. Health inequalities in diabetes care has been reported for those from ethnic minority groups, so those who are socio-economically disadvantaged, and for those who with other protected characteristics such as gender and sexuality. These disparities can impact access to care. It can impact their treatment outcomes and overall well-being. So we need to start a targeted outreach and culture appropriate education and diet advice to start getting people from these backgrounds into having these tests done. So what can you do today? So checklist: book any overdue care processes. Know when the last HbA1c and blood pressure results were. Download the NHS app, which can give you all the advice as well. Ask the GP if you've missed anything. As someone living with diabetes or supporting someone with diabetes, yeah, do a checklist. Diabetes doesn't take a break, neither should the health checks. So empower individuals you support to take ownership, share resources with individuals who are living with diabetes. NHS care to expect when you're first diagnosed with diabetes. It's important that we understand what the process is, and everyone living with diabetes should have these certain checks and appointments when they're first diagnosed to make sure that they understand the condition and can live well with diabetes. If you don't have any of these when you're first diagnosed, speak to your healthcare team, because everyone living with type 1 or type 2 diabetes should have a full assessment of the medical history and anything going on in your personal life that may affect diabetes. So a referral should be then sent to a diabetes group or education program that will work for you and your cultural background, or the same type of education in a one-to-one appointment if you prefer. It should be within a year of diagnosis if you have type 1. And if you live in England, you don't, they should be also give you information on prescriptions. So medical exemptions form so you can get your free prescriptions. If you live in England, you would need something like that. If you live in Northern Ireland and Scotland and Wales, you don't need it because obviously prescriptions are free for everyone. So generally within 6 months of being diagnosed with type 1 diabetes, you should have an individual diabetes management plan. This should be discussed and agreed on with your healthcare team. It should work for you and your cultural background, which can include your personal targets, contact details for your diabetes team, and any follow-up plans. You should then get detailed information how to live well with type 1 diabetes, including giving you your insulin, counting carbohydrates, managing your hypos, managing if you're ill, managing physical activity, things such as notifying DVLA, so you can have a certain requirements for diabetes with for driving. Doesn't mean you can't drive because you have diabetes, but there will be certain requirements you will need to follow. You should have a review with a dietitian to help look at different ways in which you can change the way you eat. Doesn't mean you have to cut out on all your goodies. Some of you can still have your treats, they can still have their cakes, but it's about having smaller portions rather than a big portion. So people won't go because they think they're not going to be able to eat what they normally do. You can, but it's just about judging it properly. And with a dietitian, that sort of stuff can be put in place, and you can be helped with that. If you're diagnosed with type 2 diabetes, you should have, if it's right for you, a discussion about weight management and weight loss. And then you can, even with the weight loss and weight management, you can then go into what we call type 2 diabetes remission. And that's when your average blood sugar levels are now no longer in range for diabetes, so you don't need medication. You should then have a review of any emotional well-being and mental health needs, because having diabetes, as we've seen, it's not just about high or low sugar. There's lots of other complications that can occur, and it can affect people's mental health. They can then have a look at a review of medication if things have changed. You can have a summary of your agreed diabetes management plan and when should it be reviewed. And with the NHS, there are some diabetes checks and appointments that you should have access to, but not everyone will need. So speak to the healthcare team if you think you need any help. Everyone with diabetes should have access to the blood test within 6 months, 3 to 6 months. The chance to meet and get support from people living with diabetes, so support groups, good quality care with access to diabetes specialists if you're in hospital, including access to mental health support, pre-pregnancy review. So if you're diabetes and you're planning to have a baby, have a review. You can get advice. And sometimes that advice should generally be around about 12 weeks prior if you're on some form of contraception or the person looking for is on contraception. They should have a review 12 weeks before they stop it. They should have regular reviews at least every 2 weeks by the diabetes team during pregnancy to keep an eye, because it can affect blood pressure and your blood sugar levels. A review of emotional health and well-being, a review and update of management plans, appointments in the way that you prefer is really important, whether that's by phone, face-to-face, or reviewing the blood sugar levels with a healthcare team online, for example, and specialists who can help you manage any diabetes complications. So everyone living with type 1 diabetes should have access to a review of the diabetes knowledge, so that you already have, on what you would like to have, what else would you like to know. You should be able to get advice from your diet, about your diet from your dietitian. You can have a thyroid function blood test. And also have a chat about diabetes technology. There's so much technology out there now, and people say they don't want to keep giving themselves injections. You don't have to. You can have certain devices that are literally fitted, and they monitor your blood sugar levels or your service users' blood sugar levels, and it gives them their insulin as they need it, so they don't have to keep checking their blood sugar levels. You can have the ones that are fitted underneath the skin. You can have ones that are fitted on the arms, and it's called the flash test. So you can basically, it monitors on your phone all the time, so that if your blood sugar levels go high or go low, it's set. So the alarm will go off on your mobile phone and wake them up to tell them blood sugar levels are dropping during the night, or their blood sugar levels are increasing during the night or during the day, and it monitors it and it tells them straight away, so they can do whatever they need to do to rectify it. So the technology that is out there now for diabetes is fantastic. So get as much information as you can about it, such as the insulin pumps, things like that. So if you're not able to manage it yourself, the insulin pumps can do that for you by monitoring your blood sugar levels and giving you the insulin as you need it. You can also get help and support from specialists who can help you manage your medication and your blood sugars, especially around physical activities. Everyone with type 2 diabetes should have access to support to lose weight if you want or need to, and get advice about physical activity. Technology can monitor blood sugar levels like continuous glucose monitor, depending on certain criteria. You have access to other NHS care that is still important for your diabetes management, like flu, COVID-19 vaccinations, screening services for other conditions, help to give up smoking, help for weight management support, help for dental care. And some areas offer other opportunities to improve your general health and diabetes well-being, like weight management, organised physical activities, activity community groups. So speak to the healthcare team. Ask them what other support is available to help you in your pathway. Diabetes UK is a really good web. There's a link on here. If you go to Diabetes UK or Google Diabetes UK, it's a fantastic website. There is so much information on there that you can get, lots of advice. There's lots of really good videos as well on there. So Diabetes UK, they can give you all sorts of advice. You can ring them, you can email them. They are very good and very helpful. So some people find it difficult to get the standard of care that they expect. So it's really important, if you don't think you or the person you're supporting are getting the checks you or they should be, speak to the healthcare team. Make a list of things. It's really, don't go there blind as such. Make a list so you know exactly questions you want to ask, because once they start talking or you start, you can miss things. So have a list. You can also order a leaflet called What Care to Expect when you have diabetes to take along to the appointment as well, and you can get that from the Diabetes UK website. If you're not getting the help that you need, then you want to complain. If you're not happy with the care you're getting, you can ask your diabetes care to happen at different clinics or hospitals. But speak to the healthcare team, call Diabetes UK helpline, which is on there as well, and they will give you so much advice, and they will help you in your next process and what you need to do to help you with your diabetes.